Me.
All right. Hey, everybody. I'm Brittany Williams, and I'm a Healthy Birth Ambassador from Region 8.
Hello, I'm Dawn Collins, and I am a Healthy Birth Ambassador from Region 7.
And we want to welcome you to our Healthy Birth Louisiana Pathway to Progress presentation. And I just want to give a little bit about me. Again, my name is Brittany, and I'm in Region 8. And I'm so excited to be a product of this vision to encourage healthy perinatal outcomes. I'm a wife and mother of three. I have two wonderful young ladies and a little gentleman that I actually birthed at home with a midwife and two doulas, one of which is a part of this cohort. I had the privilege of receiving so much from this training. There was a wealth of knowledge provided, and I was able to learn so many things about the perinatal journey. Being pregnant during the training also allowed me to apply what I learned to my own pregnancy. And I truly believe in providing education so that families can make informed decisions that benefit their family dynamic. And this training and cohort has confirmed that I should never stop learning, and I'll continue to confidently pursue further endeavors while serving my community in any way that I can. I will be forever grateful for being a part of making the case for better births.
Hello, it's me again. Let me tell you why I applied to be a Healthy Birth Ambassador. From a child, I adored and cared for children. You could call me the go to babysitter. When we had our second of three children, I started a home daycare business. And that was because I wanted to remain accessible to our growing family and also to contribute to our home financially. And in so doing, I was also able to provide a service to our military community. I witnessed plenty of families flourish, but I also witnessed the disassembling of those families, and that burdened me. Our second born, she had a senior project to do. She called it Do It Like a Doula. I attribute that to her exposure to her then youth pastor and rising doula, Crystal Cooper Taylor. Crystal connected her to Mrs. Pam Roberts. I'm sorry for the noise in the background. Mrs. Pam Roberts is a well known doula here. Pam was patient and enthusiastic as she answered Tati's questions. When she got finished, she turned to me and she said, "You should be a doula." The seed was planted in year 2016. I explained to her that I had no medical background. And she said it didn't take a medical background to become a doula, that there were few doulas here in this area, and that there were no Black doulas at all. In 2020, I saw a Facebook post about a healthy birth ambassador. It listed everything that I had been exposed to and was burdened with. I applied with nothing more than a burden and a passion. I am now equipped to serve my birthing community. I currently work as a receptionist at a compassionate nonprofit crisis pregnancy center, and I have started my own doula service business called Birth Matters Because Family Matters. Now that you know a little bit about us, we want to know who all has joined us. Before we jump into the agenda, we would like for you to participate in a short poll. We want to know if you're from Louisiana, if you've been watching the progression of this program, or if you have just been introduced to us, the Healthy
Your
Louisiana.
answers, drop your answers in the chat because somebody that would be me didn't finish the poll. So let us know. Drop your answers in the chat. Are you from Louisiana? Is this a new endeavor and information for you? Or if you've been following us for a while, and tell us how you found out about this initiative.
Please do all that. Thank you for joining us and participating in the poll. So we're looking at the chat to find out where you're from. If you're in Louisiana, if you've been watching the progression of this program, or if this is your first introduction to the Healthy Birth Louisiana initiative, let us know.
Oops. Come on, Nicole. Awesome. So Dallas said that they've been following, they were in Region 7 and also following for a while. Yes, so awesome. Thank you all for jumping in the chat. I'm sorry, Brittany, I kind of took over.
Oh, you're good. I'm looking too. I see we got Louisiana in the house for
Well,
sure.
thank you. Working in Louisiana. This is awesome. Thank you all so much for that. So I'll just go ahead and keep talking. My name is Nicole Deggins, and I'm the founder and CEO of Sister Midwife Productions. And we are definitely excited that you are here. For those of you who do not know Sister Midwife Productions, we are a birth justice, birth advocacy organization based down here in Southern Louisiana in New Orleans. And we have a mission to eliminate perinatal disparities and improve birth outcomes by increasing the numbers of Black birth workers and creating transparency and accountability within the medical obstetrical system. So we kind of do that, I would say, like in 3 different categories. So around advocacy, we sit on various boards and commissions and speak on behalf of and advocate for the families that we serve. We also teach others about advocacy and how they can advocate for themselves. In addition to that, we do a variety of free community events, free and paid combination of community events. One of them is the Art of Birthing, which happens every September. Be on the lookout for September 2021 Art of Birthing events. And the Art of Birthing has now become the primary fundraiser for this Healthy Birth Louisiana initiative. In addition to that, we have our Birth Story Project, which you will have an opportunity to hear more about later on in this program. And then finally, we do trainings. I would say that among most of the things that we're known for, nationally, we are known as a doula training organization. Since 2013, we've trained well over 300 doulas. We are actually in the first week of a new training where we have over 100 people registered for this training. And by the end of this training, we'll be able to say that we've trained nearly 500 doulas nationwide. For those of you who do not know what a doula is a non-medical professional who has been trained to support families preconceptually, during pregnancy, during labor, birth, and in the postpartum period. They are known to help decrease cesarean sections, to improve overall birth outcomes, and to increase the satisfaction that a family has with their births. Now, I have trained doulas nationwide, but because I am a New Orleans girl, I am from Louisiana, I care about my state and I care about the people in my state. I have really made a concerted effort to really want to train individuals throughout the state of Louisiana. So because of that, 70% of our students at this point are from the state of Louisiana, and 85% of them identify as Black women. That is important because when we talk about perinatal outcomes and we talk about ways to improve outcomes, we know that when we have individuals caring for us who look like us, we have an opportunity to improve outcomes. Now, while our impact has been great and we've certainly been successful with training doulas across the country, I also knew and continue to know that I've wanted to go deeper. Right now across the country, there are a lot of various initiatives really understanding the value and the benefit of employing and including doulas into the framework for maternal child health to decrease maternal mortality and then to improve maternal and infant outcomes overall. That said, what I also know is that doulas alone cannot do everything. And so as a trainer, I wanted to begin to think about how could I go deeper to create something bigger, to create something more holistic that could really support families in a more complete fashion, simply than just being a doula. So now I'm going to turn the mic over to LaRonda Coleman, who is one of our HBAs, who will give you some specific statistics to help you understand why we understood that we needed to go deeper.
Hello, everyone. I'm LaRonda Parker Coleman, a Healthy Birth Ambassador from Region 7. This opportunity to become a Healthy Birth Ambassador piqued my interest because I've always had a passion for this special population. The most rewarding thing for me was twofold. It enhanced my knowledge base, and I acquired more credentials by becoming a breastfeeding specialist while aspiring to become a childbirth educator and a childbirth doula. It has been said, if you want to go fast, go alone. But if you want to go far, go together. And with this being an amazing journey, it was coupled with these courageous ladies who each brought a wealth of knowledge to this experience. This experience has enhanced my confidence, and I will continue to provide critical information to the community in which I work and live. Through advocacy, education, and community engagement, I hope that the issue of infant mortality and maternal mortality will be brought to the forefront and garner the attention of community residents, health practitioners, public health officials, and legislators. We appreciate each one of you being a part of this journey. In 2018, the infant mortality rate in the United States was 5.7. This means that nearly 6 infants die for every 1,000 births. That is over 21,000 babies each year. And the birth of Black infants are more than twice as likely to die as white infants. The second leading cause of mortality is complications from being born too small or too soon. And both of these are directly connected to significant racial disparities that we see. Louisiana ranks 49th for preterm and low birth weight. In 2019, our infant mortality rate was 8.07 compared to 5.7 nationally. Similar to national statistics, Black infants in our state are 50% more likely to be born preterm or low birth weight and are more than twice as likely to die when compared to whites and Hispanic infants. Now, let's take a look at maternal statistics. A pregnancy-related death is a death of a woman while pregnant or within 1 year of the end of pregnancy from any cause related to or aggravated by the pregnancy or its management. The maternal mortality rate is reported as the number of deaths of 100,000 live births. In 2018, the maternal mortality rate for the United States was 17.4 per 100,000. The risk of pregnancy-related deaths for Black women is 3 to 4 times higher than those of white women. And in fact, a birth mother with a college education is 60% greater risk for maternal death than a white or Hispanic woman with less than a high school education. One statistic that is often missed when we speak about maternal mortality is the fact that every woman who dies, approximately 70 more experience a near miss of what we call severe maternal mortality. This means that over 50,000 women each year suffer significantly during pregnancy. In 2017, Louisiana had 65 pregnancy-associated deaths. Pregnancy-associated deaths include deaths from pregnancy complications, and it also includes deaths from things like accidents, injury, and suicide. Of these 65 pregnancy-associated deaths, 15 of them were pregnancy-related, meaning that these 15 mothers died as a result of complications that were created by or made worse by a pregnancy or management of her pregnancy. Disparities remain evident for pregnancy-associated deaths. Nearly 2 Black women die for every 1 white woman And for pregnancy-related deaths, more than 5 Black deaths died for every 1 white woman. Unfortunately, deaths in Louisiana is rising. But one specific thing that I omitted, and I would be remiss if I did not go back and say that at least, infant mortality simply is defined as when a baby does not reach its first birthday. Just think about that. We take for granted 365 days, the most critical period of a child's life, and so many babies in Louisiana do not reach that. So I just wanted to make sure I included that. As you can see, we have a lot of work to do in Louisiana. So now I'm going to turn things over to Victoria, who will share with you more about what we're doing. Thank you.
Thank you, LaRonda. Hello, I'm Victoria Williams. I am the program manager for Sister Midwife Productions and the Healthy Birth Ambassador, or Healthy Birth Louisiana initiative. And I'm going to take you on our journey. Are you ready? So, and we're going to discuss like how we've been walking the path to improve birth outcomes. While for some of you, this information we are sharing is new. Others of you, we know that you have been following our path. And starting in 2019, Sister Midwife Productions knew it wanted to do the work to improve birth outcomes, or to improve these outcomes. Before we got started, we also knew we needed to analyze the data. We needed to do the research. While we understood that Louisiana ranked last and mostly last for maternal mortality or maternal child health outcomes, we wanted to know where things were the worst. We asked ourselves which regions and parishes had the worst outcomes and which ones needed the most support. As we analyzed the data, we began to create a comparative analysis report of Louisiana's birth outcome. A report based on researching the maternal mortality, infant mortality, low birth weight, and preterm birth outcomes for Louisiana parishes and regions across ethnicities. We are excited to be almost finished with this report. It's been a long road, and we look forward to sharing our final report with you later next month. Some of you joined Sister Midwife Productions as we traveled all over Louisiana. While we were on tour, we were reporting our findings and sharing ideas and working to make connections and build relationships for a vision for a vision of improving birth outcomes. We shared on our tour that we wanted to create a solution that was community-led, comprehensive, and sustainable. And we were seeking support and buy-in from every community we visited. During our research and analysis, we learned that regions 7 and 8 collectively had some of the worst outcomes in the state, and few individuals available to help on the grounds to support these families. We finished the statewide tour in November 2019, and after we completed our statewide tour, we, with support of Blue Cross Blue Shield Louisiana Foundation, we've launched our Healthy Birth Louisiana Training Initiative early 2020. In February of 2020, we launched our application process. And by April 2020, in spite of COVID-19, we started our training. Our training spanned 18 weeks and included weekly Zoom calls, self-directed online learning, and virtual weekend retreats. On average, our trainees spent 10 to 15 hours per week in learning mode. Over the course of 18 weeks, our cohort of 13 women spanning from region 7 and 8 received training as a community health worker, which including foundations of public health and social determinants of health, motivational interviewing, gathering community resources, team building, conflict resolution, and more. Through a partnership with Lactation Education Resource, They also became certified breastfeeding specialists, and through Sister Midwife Productions, they received training as a community-based doula and childbirth educator. We sent out an anonymous survey to everyone in our cohort. They reported they felt the information was well organized. 90% felt they had learned new information, and nearly all of them reported feeling prepared to support families. Here are a few quotes from our HBAs. Mommy. One that stood out the most was really this revealing of this unconscious bias within themselves. And this training provided a better understanding of how to support someone with whatever decision that they may make. We are so proud of the work we have done, and we know that our Healthy Birth Ambassadors are truly ready to make the case for better birth.
Hello, everyone. I'm Linda Marie Katniss, and I'm a Healthy Birth Ambassador in Region 7. I had aspired to become a doula for about 4 years before being told by my fellow HBA, Crystal Cooper Taylor, about this wonderful opportunity. One of the most rewarding things about this training for me was that not only would I be a doula by completion, but also a certified breastfeeding specialist, a community health worker, and a childbirth educator. I've been utilizing any and all training from this program from the very moment that I began. I actually just experienced supporting my doula client through her labor and birth for my first time yesterday. And I must say, it was one of the most beautiful experiences to be a part of. I felt somewhat nervous once the moment we had been waiting for had finally arrived. But as things progressed, I realized that this training I received from this program did way more than prepare me. I was confident in everything I needed to do to ensure that my client had all of her needs met. I plan to continue to service my community by offering all of the services I've been equipped with to provide. Going forward in the future, I hope to continue to support my community and help to empower them through their birth experience. For birth is the revolution, as Sister Midwife says. So making the case. C is for community. Healthy Birth Ambassadors, as Healthy Birth Ambassadors, we live and serve in the same community. We work to build connections in our community and help individuals understand our key messages. How we give birth and how we are born matters. It matters for everyone. Mothers and infants across our state are dying at unacceptable rates. There are major disparities and Black families suffer the most, and everyone is responsible for helping to improve outcomes. A is for advocacy. We advocate for change, and we give others the tools and information to advocate for themselves. We believe the goal of advocacy is to create a wave of change that ultimately eliminates the need for advocacy.
Hi, I'm Nina Simpson. I'm a Healthy Birth Ambassador for Region 8. I decided to apply to become an HBA because I wanted to help women, babies, and families that needed it the most, whether that be a first-time mom or someone from a minority group or groups, or someone who didn't have any support at all. One of the most rewarding things about the training was just the wealth of information that I learned. And a goal that I have for my birth work journey is I aspire to own my own business. As a lactation consultant, I would be lactation consulting and also doing postpartum doula work. And I would just continue servicing the community through the business. S is for service and support. As HBAs, we serve and support families, our community, and each other. I have truly enjoyed how, as a cohort, we have naturally begun to support each other as we serve families. And finally, E is for educate. As Healthy Birth Ambassadors, we know that we must continue to educate ourselves as well as others about the issues and, more importantly, solutions.
Hey everybody, I am Jasmine Williams. I am a Healthy Birth Ambassador. I'm a certified breastfeeding specialist, herbalist, and doula. Um, I got interested in the Healthy Birth Ambassador program. It was after I delivered my second baby, my youngest. Her name is Journey. With my oldest daughter, I unfortunately experienced doctors not listening to me or my husband. And while I was pregnant with my second daughter, and I started doing my own research, I discovered that hey, I can advocate for myself. And so at that moment, it was like kind of like a switch went off in my head, and I was just like, okay, if I didn't know that I could advocate for myself, I know other moms, I know other families don't know this either. So thankfully this cohort came about and I applied and was able to join, and it's honestly been life changing. Just today, I was talking to a mom that I've been helping, from afar, but I've been helping her for the last few months, and she's been experiencing some things, and her doctor wasn't listening to her, and she was able to advocate for herself today. And she told me today, she was like, Jazz, if it wasn't for you, I wouldn't have been able to have that voice to do that. And I cried because I'm like, okay, if it wasn't for this, what if I had said no to this program, or what if this program didn't exist? I wouldn't have been able to have the confidence to let another mom know that hey, you can advocate for yourself. So she did, and yeah. But I plan to continue to utilize the tools and the things that I've learned here to help other moms, to help other families, because community and families have always been a passion of mine anyway. And I'm proud to say that I'm actually going to be facilitating my first birth, and it's actually a home birth in July. So yay! Um, Definitely want to give a shout out to Aubrey Clow. She is a Healthy Birth Ambassador out in Region 7, and she unfortunately couldn't be here tonight, but she's servicing her community, and she's doing an amazing job there as well. And in addition to myself and the other 8 Louisiana Healthy Birth Ambassadors, the rest of our training cohort was rounded out with 4 other amazing women. As you see here on this slide, they've completed the portion of the training as well, and they're also servicing their communities. And I am going to put it back in the hands of Victoria.
Wow, thank you, Jasmine. Immediately after our HBAs received their training, they got on the ground running to do the work. In less than a year, they have done tremendous work in the community, and it shows here and throughout their service reporting. Um, from that service report, we have 314 pregnant clients. So when we're using the word clients, but we're really thinking about touches and how many times that our Healthy Birth Ambassadors have created a talk or training, or counseled a pregnant person or person during the postpartum period. Also assisted with some lactation counseling, whether that was like a hand-to-hand breastfeeding information, or just small consults and text messages and all those things that we do as community health workers. So we are proud of the work that we've done thus far, and we are still committed to training at least one cohort in each region of the state of Louisiana. Our goal is to increase the number of trained individuals to support families during pregnancy, birth, and postpartum period. We want to increase awareness of birth options during the childbirthing, among childbirthing families. We want to decrease the number of families reporting poor birth outcomes or poor birth experiences. We want to increase breastfeeding rates, decrease infant mortality and low birth weight, decrease C-section rates, improve Louisiana's national ranking of maternal and infant health. And now I will turn it over to our HBA so they can share what you can do to join our path.
Hi, I'm Crystal Cooper Taylor, and I am the HBA in Region 7. I'm also a wife and a mother of 2. In my first birth, I experienced implicit bias and my OB trying to push me into a planned induction. I can remember one day after a prenatal visit, he tapped me on the back and he said, "I'm going to keep asking until you give in." Since then, I've been running with passion for families. I decided to apply for HBA because I believe in what Sister Midwives is doing. I already had taken her doula training, and so I figured, why reinvent the wheel when there is an amazing opportunity to join in unity for our community. One of the rewarding parts of the training was lactation. I always wanted to dive into the IBCLC, and becoming a lactation specialist was just a little icing on the cake for me. Now being at HBA, I have already used the education in so many ways I can count. My goal as a birth worker is to continue to provide support for families, and I am now a student midwife and a clinical assistant at Bonfit Maternity. I want to share information with you about the Birth Story Project. The Birth Story Project started off as a safe sharing circle for Black women to come together to share their birth experiences and mothering journey. During the statewide tour that Victoria shared with you earlier, I was able to host a Birth Story Project event in Shreveport. It was well attended and confirmed the need for such events in a safe place. At that event, there was laughter, there was crying, there was most of all healing for the mothers there. Eventually, Sister Midwives realized they needed to get more data, and so they launched the Birth Story Project online survey, which was available for all moms statewide. As we move into the summer, Healthy Birth Ambassadors will be working in our community to help with a relaunch of the Birth Story Project. And here are some of the preliminary results from our survey. 88% of the survey respondents gave birth in the hospital. 41% were using Medicaid or uninsured. Because of this training program, we were fully vested in the survey, and as a result, 14% of the respondents came from Region 7 and Region 8. 5% of them gave birth at Oshner in Shreveport. 35% of the women gave birth by cesarean. 76 of those women were first-time cesarean sections. And we know that C-sections are associated with an increase in mobility and mortality. And research also tells us that doulas help reduce the risk of cesarean sections. 69 of the respondents did not have a doula. And out of the 69%, 33% didn't know what a doula was or how to find one. And 27%, they could not afford one. And here are some unfortunate quotes from the survey. It says, "I was never asked permission for any of the procedures that took place. I was taken advantage of as a young and inexperienced woman. I was referred to this doctor by family members, but he was never willing to answer questions nor had any birthing class info. At 39 weeks, my doctor shocked me by saying I had to have my water broken because she was going out of town. I was completely devastated, but still trusting my doctor. I allowed it to happen. My body was nowhere near ready to have my baby, which resulted in an unwanted epidural, which turned into a C-section." Where am I at? I'm sorry, I lost my place. Okay. In fact, greater than, did I say that already? Okay, I'm sorry. I might repeat myself again, but I'll figure it out. In fact, greater than 50% of the respondents said they felt pushed into accepting options their healthcare provider suggested. These are the stats and outcomes that we want to change for HBA. The survey is currently offline, but it will be relaunching this summer. And once it relaunches, you can definitely join us on the path by taking the survey yourself. Sharing the survey with community, friends, and family and congregation, are hosting a live sharing circle. As a Healthy Birth Ambassador, we will be looking to partner with community and based organizations who are interested in hosting a circle. Thank you so much.
Hello, everyone. I'm Alicia Mingo, and I reside and serve in Region 7. A little bit about myself. I'm a minister at Praise Temple Full Gospel Baptist Cathedral here in Shreveport. I'm also a licensed practical nurse, and I'm certified in the state of Louisiana as a child care health consultant. I am also a healthy birth ambassador and a certified breastfeeding specialist and a childbirth educator. I've birthed and breastfed two spectacular children, and I'm married to an amazing man, Mr. Adam Mingo. I decided to become a healthy birth ambassador because of the breastfeeding component. As a new mother, I spent hours on the internet searching for evidence-based information regarding breastfeeding. As a healthy birth ambassador, I knew I would be able to give other mothers with a desire to breastfeed accurate and evidence-based information. I wanted to ensure that this information was readily available to everyone. Through this training, I learned that women could safely give birth without interventions. I also learned that 60% of maternal deaths were possibly preventable. This was truly my call to action, as it is unacceptable. As a Healthy Birth Ambassador, I host a virtual childbirth education presentation on the second Saturday of the month with close to 1,500 views, and these are virtual. I was also able to partner with the Northwest Louisiana Community Development Center to host a pregnancy resource fair to educate and inform families of the resources available to them. My passion is to help families walk through the joys and the challenges of pregnancy, birth, and postpartum, well educated and informed, to enable them to make healthy decisions for their family and to allow them to transition into a healthy family unit. While the Birth Story Project is a great hands-on way to support the Healthy Birth Initiative, there's also a few other ways that you can get involved. And it's really simple. You can tell somebody. Tell somebody about the initiative. Tell somebody about the information that you're learning tonight. Tell somebody about the maternal and infant health crisis that we're facing. Tell somebody about what we're doing to make a difference and to even save lives. Specifically for faith-based institutions, we will be creating an informational card based on scripture with biblical references that can easily be used to provide quick bullet points as a part of church announcements, or that can be printed as the church bulletin. You can hire a healthy birth ambassador. Maybe you're a pregnant family, or you know a pregnant family. This can be dad or mom, whoever needs services. Hire a healthy birth ambassador for yourself or for someone else. You can bring a healthy birth ambassador into your organization, into your clinic, your place of business, or congregation to give an advocacy presentation, where they can teach attendees about advocating for better births. Or perhaps you want to expand the services of your organization and you're looking for a new way to support families that you serve. As Healthy Birth Ambassadors, we are here, we are competent, and we are ready to serve. Finally, you may want to sponsor the training for a new Healthy Birth Ambassador. Sister Midwife Productions is working on plans to begin they've begun a new training cohort. And in the meantime, there's always a need for additional funding. So whether you fully sponsor a Healthy Birth Ambassador, whether you decide to make a small donation or help sponsor the Art of Birthing, which is one of our major fundraisers in September, all of it will help us to increase the number of individuals trained to support families during pregnancy and birth. And I also want you to remember, by supporting our efforts, you may very well be saving someone's life.
Come on, Alicia. Thank you for bringing that to a close, baby. That was beautiful. Y'all, this is real talk. And we do hope we've shared this information, we've shared our initiative, and we hope that you will think about how you can directly join us on the path. There are so many ways to get involved, from simply sharing a story, sharing this on Facebook. If you are on Facebook, share this information session with the people that you know inside of your circle. As we move to begin closing back, I want to bring us back to LaRonda. LaRonda's testimony really touched me because, as you can see here, she said, I am so glad to be affiliated with Sister Midwife Productions. This work is my life's work at this point. It really was. It's apparently always been a calling for me, but you never really know how things are going to lead you into the spaces where you're supposed to go. You never really know how the path will be carved out for you, and sometimes we have to walk the path less traveled. One of the things that LaRonda shared with you earlier today were a lot of the statistics. And so a lot of times we hear the statistics, our babies, Black babies die 2-1, our mamas die 3 or 4-1. But one of the things that I want to always make sure that we remember is that behind every number, there is a person. There is a family. There are real lives that have been impacted by the bad statistics that we see. And so I want to share with you all briefly a story about a woman who I never met personally, but who has touched my life completely over the past few years. So I will say to you that it was a day I was sitting waiting for my daughter to get out of piano lesson, and I received a text message from a doula that I had trained, who said to me she knew of a friend who had given birth and who was found about a day and a half later, 2 days later, the day before she was actually going to be discharged to go home. She was found on her postpartum floor, unconscious, and she was currently in the ICU. So we talked a little bit about the situation. We said a prayer, we gave love, and I asked her to keep me posted. About 2 days later, I get another phone call from another person who says to me, hey, I need you to talk to my barber. His sister had a baby a few days ago. They found her on the floor unconscious. She's currently in the ICU. Now, I didn't realize that all of these people were necessarily connected, but I immediately knew that this had to be the same person. And so I said, well, who is your barber? And so she tells me the person's name, Brother Akil. I said, wait a minute, Brother Akil on Bayou Road, whose lady has a daughter who plays with my daughter, who I know, who they're friends of mine. This is his sister. So this is a person who I know, who is personally connected to me. So about 2 days later, I talked to her brother and we have a conversation. He's letting me know that the prognosis is not really good. And I think it was maybe 2 weeks after her delivery that the family made a decision to pull life supporting measures and allowed her to move into the other realm of existence. And she became an ancestor. So however long it happened from when she passed to when it was her funeral was literally around the corner from my house, like walking distance, literally like 3 blocks away. And I remember the day it was storming, raining, and I was planning to walk when I found out where the funeral was, but it was storming, raining. But I was like, how can you not go? It's around the corner. You must go. You must go to this funeral. So I'm in her funeral, and person after person after person is stepping up to speak their love for Lashana. How wonderful she was, how she was a light bulb in the room, how much love she gave to everybody, how much support she gave to everybody. And I sat there thinking to myself, my God, how does this happen that a person who has given so much loses their life so early with young children and a husband and a family? And it was just really heartbreaking. And in the middle of this funeral, I received a download, and the download was like, you will use her story to tell the masses about maternal mortality, about birth options, about infant and maternal child health. You will use her story to talk to faith-based institutions, to talk to the pastors and say, hey, pastor, it's somebody in your church who is pregnant right now, who needs this support. And I always wonder, what would her story be like? Maybe no different. Maybe this was her journey. I don't know. But what could we have done differently had she had someone in her corner supporting her through this entire process through her birth and delivery and after she gave birth? I don't really know, but I know that I received that download that day in her service telling me that I needed to use her story and to raise her up as an example of why we need to do this work and to continue to speak her name. Now, the story gets even more interesting because, like I mentioned to you, I never met her in person, but her spirit has been following me ever since I got connected to her. So maybe 2 weeks after her funeral, Victoria and I are in Baton Rouge at an event at the state capitol building sponsored by the Louisiana Center for Health Equity. And we're standing, we have a table, and I have a conversation with the woman next to me. And she's like, I remember you. You spoke at this other conference and you were talking about, infant and maternal death. She said, I just went to a funeral. I just went to a funeral last week from someone who lost their life to maternal mortality. I said, was it LaShawna? She said, oh, yes, it was LaShawna. And so we had a conversation because she knew her personally. Maybe a month later, I am at another meeting. AmeriHealth Caritas was one of our partners. They hosted the Birth Story Project here in New Orleans. So I'm at this event, I'm at this meeting rather, and we're talking about they're partnering with us to host the Birth Story Project. And there's a woman in the meeting and she asked me, she said, well, I hear you keep saying about black moms and safe place for black moms. Why are you focusing on black moms? And so I go into the statistics of black maternal mortality and things of that nature. And she says, like my friend, my good sister friend who just died. I said, LaShawna? She said, yeah, LaShawna. And I'm like blown away. While we were on our tour in Lafayette and in Baton Rouge, we had individuals at our meeting who knew LaShawna. And so I knew that this is no accident, that this is by faith, that I must walk on this journey to continue to speak her name. African proverb tells us that until you no longer say my name, my energy still exists. I still exist in the lives of my community. So we say her name today, LaShawna Mitchell Bell. And in addition to that, as I continued the work and speaking about her, I learned, because everybody else called her Nikki. So I've been calling her LaShawna because that's what I knew her as. That's how I met her. But then I find out that her middle name is Nicole. And I take nothing for granted. I don't believe in just random coincidences. And so her story and who she was and who she continues to be a light for me to continue to do this work. I do this work on behalf of her, on behalf of her family, on behalf of my brother Akil, who was her biological blood brother, on behalf of her husband and her children. And so I lift her family up tonight. I lift her name up, LaShawna Mitchell Bell. We speak her name, we say her name, and we will continue to always honor her as we continue to do this work. So as I move forward, it's always hard to come from that to then have to finish and wrap up the presentation. It's just every time I tell the story and feel the energy of it. And I think I saw somebody's name in the attendance tonight who knew her personally, who is a part of this story that I just told. And so I'm sending you love also as we remember Nikki this evening. I also want to just give thanks to the Blue Cross and Blue Shield Foundation of Louisiana, because without their financial support, this would not be happening. I know you heard a number of the women say how excited they were about the lactation education portion of this program. And so we definitely want to give thanks to LER for their lactation support and how they were very generous in their support of this program. And then Plumtree Baby for assisting us with providing some wonderful evidence-based PowerPoints that our the childbirth educator in these Healthy Birth Ambassadors can use to service their community. So as we round out this evening, I want you to know that we are here. We are open for questions. We hope that you will consider joining us on the path as we continue to make the case for better birth for Louisiana. You can email programs@sistermidwife.com. That will get you in touch with Victoria, who mentioned that she is a program manager for this initiative. And if you're listening on Facebook and you're not from Louisiana and you're interested in bringing this program to your state, just shoot us an email. We'd love to have a conversation conversation with you about it. And if you have any particular questions about Sister Midwife Productions directly, you can email us, contact us at sistermidwife.com. So with that, we have come to the end of the presentation. Again, I really want to thank you all for joining us, for being here. We are so appreciative, whether you are live here with us in our Zoom call or on our live Facebook. I understand the live on Facebook has been shared like 15 times. So somebody is on Facebook watching this presentation. We appreciate the work that you also do to support families in your communities. And if you're not doing nothing to support families in your communities, now you know a way that you can. So reach out to us so that you can be a part of this beautiful program. And thank you all, everybody, shouting out Lashana's name in the chat. I appreciate it. If there are any questions, comments, thoughts that anyone wants to share, we're here and this is your time to do that.